Good afternoon, everyone. I'm Hongsoo Kim, a professor at Seoul National University's Graduate School of Public Health. It's a pleasure to share insight on Seoul's public-private collaboration model in elder care based on our study with the APO project. Today, I will highlight how public and private sectors work together in Seoul's healthcare and social care systems and discuss lessons that may be applicable to other aging society. Why Seoul? South Korea is one of the fastest aging countries globally. Over 20% of the population became to be 65 or older this year. Seoul, as a megacity with a diverse elderly population, provides an important case for studying how health and social care services are organized, financed, and delivered through public-private collaboration. South Korea's elder care system is publicly financed in a nutshell, but mainly primarily delivered by private providers. At the national level, the Ministry of Health and Welfare oversees NHI, National Health Insurance, and Long-Term Care Insurance, LTCI, both social insurance. NHI provides universal medical coverage through private hospital and clinics. LTCI covers care services for older adults with functional limitations, delivered mainly by private providers. At the Seoul Metropolitan Government at SMG level, Seoul plays a key roles in overseeing national programs while also developing its own public health and social care services, particularly for lower-income older adults. Coordinating community-based health initiatives to fill service gaps. Social care services are locally administered and funded through both Seoul as well as central government taxation, with Seoul contracting private social welfare agency to deliver programs such as home visit and meal supports. Long-term care insurance in South Korea provides care service for older adults with functional limitation. Eligibility basically available for all 65 or older and those with geriatric condition, regardless of income level. But not all applicants are eligible. Eligibility is assessed by trained NHI staff using some standardized tool, and they also need some physical statements confirming the applicant has a certain level of functional limitation. For eligibility of customized care service for the adults, this is community-based social care. It's mainly target disadvantaged population. Those are still ineligible for LTC. Their level of needs is not that high, but people still need some care needs. They are the target. This also needs nationally standardized assessment too. In South Korea, healthcare for older adults operates through a multi-level governance systems involving both public and private sectors. At the national level, the Ministry of Health and Welfare oversees national health insurance, which finances medical services. Most health services are delivered by primary hospital and clinics under public insurance coverage. At the Seoul Metropolitan Government level, SMG implements national health policies while also operating public health programs to promote preventive care and chronic care disease management. At the district level, public health centers provide localized healthcare services, ensuring accessibility for older adults in the community. This public-private collaboration expands healthcare access, but challenges remain in coordinating service delivery between different actors. Similar to healthcare, social care for older adults also under multi-level governments, they are delivered in the collaboration between public and private sectors. At the national level, the Ministry of Health and Welfare provides policy oversight. And for LTCI, the NHIS basically operate full financial operation. But for customized care service for elderly, it's partially funded by central government, but partially funded by the city government. At the Seoul metropolitan government level, Seoul administers public social care programs and contracts private social welfare agencies to deliver services such as home visit, meal support, elderly welfare center for vulnerable seniors. At the district level, local government coordinates service with NGOs and private providers, ensuring customized care service reach those in need. Unlike healthcare, which rely on a structured insurance system, social care is funded through local as well as central taxation and has more regional variation in service availability. The Seoul Health Companion Program for Older Adults, SHC program, launched by SMG, Seoul Metropolitan Government in 2023, supports multi-morbid older adults, especially those living alone or with a spouse, to promote aging in place. Private clinics identify high-risk patients and refer them to public health center for continuity care. Before launching this program, those private and public sectors are pretty much fragmented. They see each other, same patients, sometimes different patients, but they don't talk to each other much. So the program is basically linking the private and public sector collaboration. So private clinic identify patients, but their services sometimes limit on visit for 3 months, per 3 months. But this time now they can refer those patients still in need to monitoring. They refer them to PHC, the public health center. Then public health centers interdisciplinary team can continue follow up their helping their self-care management for their chronic conditions. The blood pressure monitoring, nutrition guidance, physical activity, kind of all the management they can advise and they can encourage them to do their work, basically self-care. So SHC somehow fill care gaps by integrating public health and private medical services, improving long-term support for older adults. This figure shows how private clinic and PHC collaborate to manage older adults' health. Private clinic refer eligible older adults to PHC, PHC coordinating ongoing care, ensuring patients receive preventive and community-based health services. This public-private linkage helps bridge medical care with long-term community supports, strengthening health outcome for older adults. As we conclude, I would like to summarize the key lesson from Seoul's public-private collaboration model for elderly care and highlight some recent policy efforts. Seoul's elderly care system, in a nutshell, primarily publicly financed but rely on private provider for service delivery. It is closely linked to national-level programs such as NHI, National Health Insurance for health services, and long-term care insurance for social care. While this model expands access, it also presents challenges in cost control and aligning public and private sector goals. Traditionally, Seoul's public health service has limited room for public-private partnership (PPP). However, new initiatives such as SHC program and piloting private sector engagement to enhance care continuity for older adults. While outsourcing for private providers has improved access, it has also led to weak cost control and limited oversight of spending. Ensuring public-private alignment remain a key challenge as private provider operate within more likely market-driven incentives. Lastly, I would like to mention briefly, South Korea has recently introduced several national policy aimed at strengthening integration between health and social care. You see the list, and the act was enacted, so that's the main one. The latter post-COVID era, COVID really accelerated digital transformation, leading to new opportunity in public-private partnership. So more will come. Thank you. That's the end of my presentation.